name's Jackie. I'm going to be your nurse today. I'm going to be doing your physical assessment. What was your name?
Laura.
Laura. Okay, Laura, nice to meet you. So first, let's get started. I'm going to do a quick head to toe assessment on you. First, I'm going to start by examining your head and your neck area. So first, can I have you remove your glasses, please?
Certainly.
Okay. So go ahead and just lean your head forward. I'm going to start by examining your hair, looking for any open areas in your scalp, but Florida sun is brutal down here. Any hair breakage. Hair looks good, not seeing any breakage, no break in the scalp, no open lesions. Good. Alright. Okay, next I'm going to go ahead and I'm going to examine behind your ears. I'm going to be looking for any open lesions on your ears, any active drainage out of the side, and the shape of them as well. Very good. Let me grab out my pen light. I'm just going to shine in. Look for any leakage. Alright, looks great. I see none. Go ahead and tilt your head to the right for me. Alright, examining the front and the back. Looks good, no open lesions. Let me go ahead, take a peek. Alright. I see no active leaking or drainage. Good. Alright. Next, I'm going to go ahead and examine your frontal and your, let's see here. Any issues with your sinuses lately at all?
No.
Okay. Examine your frontal sinuses here, your temporal as well. Alright. Just going to lightly palpate. Any pressure felt at all?
No.
Okay. Alright, good. While I'm at it, I'm going to go ahead and palpate. I want to palpate your temporal. Okay. Alright, and TMJ back here. Okay, go ahead and open again for me. Okay, and then bite down. Alright. No cracking, anything heard. Good, good. Okay, next, I'm going to be examining your eyes. We'll do a quick vision test and check out your pupils as well. So go ahead and put your glasses back on for me. Good. And first, I'm going to actually go ahead and remove your glasses again.
Certainly.
And then go ahead, I want to just check the physical aspects first. So go ahead and raise your eyebrows. Good. Close your eyes. Good. And go ahead and follow my finger this way. Good. Okay. Go ahead and put your glasses back on. Go ahead. Inspect physically. Look at the whites, the conjunctiva. Good. Alright. White, no redness, looks good. Eyelids look great. Okay, so next I'm going to just check your pupil constriction. So I'm going to go ahead and get in front of you here. And do me a favor, go ahead and look straight forward. And go ahead and cover, let's do your right eye first. I'm just going to shine this in and check for your pupil constriction. Alright, go ahead and follow it. Good. And follow it. Good. Alright, and let's replace the opposite. Good. And follow the light for me. Good. Okay, go ahead and uncover that. And let's switch back sides. Cover your left side for me, please. Okay, go ahead, follow my finger. Over. Okay, good. go ahead and switch sides for me. Good. All right, now go ahead and keep that eye covered, and I'm just gonna check your horizons. So go ahead and just follow the tip of my finger. Okay, go ahead, good, switch sides, and then same thing. Down. All right, good, good, good. All right, constriction looks good. Next, we're gonna go ahead and I'll have you keep your glasses on and we'll do the vision test. So go ahead and cover your right side first. And then I'll have you just read the letters and numbers that are on this paper.
Okay.
You go ahead and take it into your hand and perfect distance. If you can just read that out loud.
AC156XYZ.
Good.
Or it's
Okay.
5 or S.
No, you had it. It's a 5.
Okay.
The print on these can be off a little.
Okay.
All right, there you go.
I need AC156XYZ.
Perfect. Good, good. Any issues with blurriness?
No.
Okay, other than the print then, those are fine then. Okay, good. So I'm gonna come back over here, and next I'm gonna do, so we've done the vision test. I'm gonna go ahead and do the hearing test with you. So go ahead and cover your right side ear, and I'm gonna whisper three words, and let me know what I say, if you can repeat it back out loud for me.
Okay.
Red, white, and blue.
Red, white, and blue.
Good. Okay, go ahead and cover that side. I'm gonna come around. Black, white, gray.
Black, white, and gray.
Good. Any troubles with that at all?
No.
No? Okay, good. All right, love. So next, vision is great. Scalp was great. Hearing was good. I'm just gonna continue your overall skin examination. So let's go ahead. We already started with the forehead. I need to go ahead and look into your nostrils. So go ahead and tilt your, thank you. Just looking for any drainage, any lesions. Good. All right, let's do the opposite. No drainage, no lesions present. Good. Palpate here. All right, good. Okay. All right, go ahead and open your mouth for me. I'm just going to be inspecting your teeth, your, do you have your tonsils in?
No.
Okay, you have them removed. Okay, if you can just open your mouth for me, I'm going to be inspecting your tongue, teeth, and the inside of your mouth for any open lesions. Okay? Good. Alright, let's go ahead and check those cranial nerves too. So go ahead and stick your tongue out for me. Good. Okay, and open your mouth wide and say ah. Okay, one more time for me. Good. All right, and then can I have you just move your tongue, open your mouth and move your tongue from side to side? Okay, good, top to bottom. And go ahead and clench your jaws for me again. Good, smile. Okay, good, good, good. All right. All right, next I'm gonna be checking your glands. So I am going to palpate the back of your head. Let me know if you feel any tenderness. Okay, good. Go ahead and tilt your head up to the ceiling for me. I'm going to feel those lymph nodes. Okay. Any tenderness?
No.
No? Okay. Good, good. Let's see. Okay, you'll go ahead and bite down again for me. All right. Okay. Any pain, abnormality at all? Okay. All right. So next what I'd like to do, I'm going to just continue while we're hitting the pulses. I'm going to feel your carotids one at a time on each side, and then I'll kind of work my way down, all the way down to your toes, hitting all those pulses, okay?
Okay.
So I'll start on this side. You can just breathe normal. Okay, palpation's good over there. We'll do this opposite side. Okay, good. All right. Go ahead and, yeah, if you can just lay your arms flat like that. Checking all the pulses here. Brachial's good. The radial. Strong and bounding, good. Okay. And if you can just go ahead and just rotate your legs a little bit forward for me. Just I need to get behind your knees as well.
Oh, okay.
Yep. Okay. Alright, pulse is good behind the knee. Okay. I'm gonna go behind the ankle. Good. Good. And pedal. Good. Alright, all the pulses are good. Next, what I want to focus on is go ahead and just move your hands forward like this. And I'm going to go ahead and check for skin turgor and capillary refill. So we'll do the hands first and then we'll do the toes. So first I'll be checking skin turgor. Good, elasticity is great. Alright, good. And then go ahead and flip them back around and I'm going to check each finger for blood return. Great. Alright, return looks great on all those. I'm going to say less than 3 seconds. Alright, good. Skin overall looks good. No open regions. Good. Okay, let's go ahead and check the feet just so I can keep this within range. Go ahead and you can, there you go.
Or I can put my feet up on the side.
Okay, yeah, that'll work too. Alright. So checking the cap refill on the feet. Good. Good. Each individual toe is like less than 3 on the return, so that's great circulation. I'm gonna go ahead and check skin turgor in the feet too. Good. And on the skin check, I don't see anything open. No open lesions, cuts or scrapes. That's great. Okay. So next, let's go ahead and I'm gonna listen to your heart and lungs. So we'll start with the lungs. Before I listen, well, let me listen first, and then I'm gonna auscultate first, and then I'll do the palpation. All right. You can go ahead and breathe regular for me. So I'm going to be listening, but as you're breathing in and out, I'm also going to observe the motion of your chest as well. And I'm also going to be looking at any abnormal bone structure. All right, go ahead and just breathe regular for me. Go ahead, I'm going to come around the side. Deep breath for me. Good. Deep breath for me. Good. And then what I'm gonna have you do, if you don't mind, if you're able to just flip around so I can palpate your back, or excuse me, listen to your lungs from the back. Alright, good. A deep breath for me. Good. Alright. Great. Good. Alright, let me just put this up. Good. And then while I have you turned around, go ahead and just take some steady breaths for me. I'm just gonna watch the movement of your structure as you're breathing in and out, looking for any abnormalities. Good, observation is good. I'm just gonna go ahead and palpate. Let me know if you feel any pain or discomfort, okay? All right. And then you can just breathe regular. Good. I'm just going to check under the bra for, alright, the rest of that skin check looks good as well. Okay, go ahead and turn around for me. Let's see here. Okay, doing great on time. Alright, so same order of business, go ahead and breathe regular. I'm just going to observe your chest movement, okay? And go ahead. Alright, good. Alright, I'm going to go ahead and percuss a little bit. Any pain or discomfort? Okay. Down here. Good. Okay. Alright. Looks good. Let me go ahead and while I have you upright, we're going to listen to your heart next. And when I start with the heart, I'm just going to kind of explain what I'm doing as I'm doing it, where I'm listening. So first, I'm going to start with, I'm going to first listen to the upright with my stethoscope, and then I'm going to flip over and I'll be listening for any murmurs as well with the bell. So first off, I'm going to be listening to the aortic region. So you can go ahead and breathe normal. Good. Alright. Pulmonic. Okay. Alright. Tricuspid. I'm sorry, I'm going to lift your breast up. Good, and mitral. Good. I'm going to flip over with my bell here. Same thing, aortic region. Good. Pulmonic. Okay. And lift up, good. Alright, tricuspid. And mitral. Good. Okay. Put those down and listen to your stomach after. So generally, so I've listed all the regions. So the aortic, pulmonic, tricuspid, and your mitral regions. Now, if I were to have heard a murmur, it would be after, so a systolic murmur would have been after S1, and a diastolic murmur would have been after the S2 region. Now, if I heard a murmur of any type, I would have you lay down on your left side laterally, and I would listen with your arm upright if I heard any abnormalities. So everything looked good, sounded good with the heart and the lungs. So next what I'd like to have you do is I need to examine your abdominal region. So go ahead and lay, lay supine for me back there. Make sure you're within, okay. So first I'm gonna auscultate your stomach, and then I will palpate and percuss afterwards. So you can just keep your hands on the side, however you're most comfortable. I'm just gonna listen to all 4 quadrants on your bowel sounds, okay? Good. Alright, next I'm going to palpate your stomach. I'm just going to be listening, I'm going to be feeling for any abnormalities, any lumps. Let me know if you have any pain or discomfort. Okay. Good. Alright, next I'm going to percuss, so you're going to just feel some light tapping. Good. And then next I'm going to be palpating your liver and your kidneys. Go ahead. Any pain or discomfort? Okay. Alright. Any pain or discomfort there? No? This side here. Any pain or discomfort? Okay. I'm going to just observe your breathing motion in your stomach next. So go ahead and just breathe normal. I'm going to observe your skin. Looking for any bone abnormalities or placement issues. Alright, looks good. Alright. I did want to, your aortic there. That pulse. I think we missed the aortic when we were doing the others. Okay, there it is. That's strong mounting. Okay, good. Good, good, good. Okay. So next, while we have you lay in supine, I am going to go ahead and check out your range of motion. So we'll start with the hips, and then after we finish with the hips, I'm going to have you sit upright and we'll do your spine, and then we'll finish by you standing.
Okay.
So kind of just mimic what I do. I'm going to be observing your hip motion. So I'm going to start by, actually you can keep comfortable. Let's start by, go ahead and just start with this leg. Go out for, we're going to do abduction first. So outward and then back in. Good. And let's do the other best you can. Out and then back in. Go ahead and, so I'm going to have you touch the back of this heel with your knee there. Good. And go ahead and move your knee to your chest best you can. And then abduct back out. Good. And then vice versa. There you go. All the way down to the couch there. And then bring it in all the way you can. There you go. Good. And then let's go ahead, whichever leg you want to start with, best you can, knee to your chest. Inward. Good. Reflexation. Good. In the back. Alright. And then with your left, go ahead and just lean your leg upright in circular motion. Good. and then go ahead with the other. All right, good, good, good. Any pain,
No.
popping, discomfort, anything?
Not yet.
Okay, good, good, good. All right, so looks good for the hips. If I can have you just sit back upright, we'll continue with the range of motion. So while we're focused on the lower extremity, I'll go ahead and examine the knees next for range of motion. So if you can just go ahead and touch my hand with your toe. Good, good. All right, go ahead and raise it back up, and just don't let me force you down. The chest and testing for strength. Good. Go ahead, back down, and same thing. All right, good. Next is the ankles. So go ahead and do a circle, same as you did with your hips. A circular motion. All right, and then back the other way. There you go. Good. All right, and then opposite way. Good. Flexation looks good. Extension. Okay, so go ahead and raise your leg up and try to have your toes point towards the ceiling. Flexation, and then downward too, best you can. Good. All right, toes to the ceiling for flexation, extension, good, and then go downward. All right, good. All right, so lower extremities are good. Next, let's go ahead and we will do the spine, the shoulders, elbow, and wrists as well. So let's start at the top there, and I'm going to be looking at your range of motion on your neck. So go ahead and look all the way towards the floor. Good. And then go ahead, raise back up towards the ceiling. Good. And best you can, circular motion. All right, good. And then next, go ahead and look straight forward and do a good shoulder shrug for me. All right, good. And testing for strength, go ahead and shoulder shrug for me, but just don't work against me. Don't let me work against you. Good. All right. So next we're going to do flexation and extension as well on the shoulders. So go ahead and just do arms straight out. Good. Go down and then go all the way up, and then do an X behind your back best you can. All right, good. Go ahead and lower them. That looks great. Let's next do I want to look at the elbows for range of motion. So go ahead, yeah, best you can straight out, and then go ahead and flex around and bend up, and then all the way down, best you can. There you go. Okay, good. Arms out again. I just need to check the strength of those. So go ahead and bend up towards yourself, just like you were kind of lifting a weight. Go ahead. There you go. Any pain? Nothing? Okay. Let's go ahead and check the range of motion of your wrists and your fingers. So straight out, do circles best you can. All right, extend towards the ceiling, fingers up, fingers down. I'll check your grip strength. So squeeze both, okay, hard as you can. Okay, good. Go ahead, keep arms out. We're gonna do flexation and extension. So towards the ceiling, below, and then wiggle your fingers. All right, good. And then circles again. All right, you feel okay?
Yep.
Okay, good. So next we're gonna do, I need to assess the spine for range of motion as well. So, all right. So with this, go ahead and stand upright best you can. And then I'm gonna first have you just with your arms forward like this. Go ahead and just bend over all the way down, touch your toes. Stay there for just a minute. All right, come on back up. And then one more time for me. Good? All right, come back up. And then next, go ahead and just lean back like this. Good. Flexation looks good. Okay. And then go ahead and roll your hips hips, the circle. Good. Alright. Okay. And then holding your arms to hips, go ahead and flex out and then extend back in. Good. Okay. And the lower extremity strength, if you can just keep your arms upright like this, I want to have you balance on your left leg, extend your, hyperextend your right leg just backwards and balance. There you go. Okay, good. And doing the same, go ahead and extend, there you go. And let's check forward as well. So best you can. There you go. Good. There you go. All right, and then checking your balance and coordination. Go ahead and just upright on the tippy toes. Good. And then one more time. All right. Okay, good. Let's go ahead and have you sit back down. All right. Do you have any questions for me at all? Any concerns?
Not at this time.
Okay, all right. So I'm just gonna reverbalize everything that we assessed today. So started with your head and your neck. Hair was great, there was no breakage there. The skin looked great, didn't find any open lesions. Range of motion was outstanding, didn't see any abnormalities there. Heart and lungs sounded great. Stomach, I heard hyper vowel sounds when I listened, so that was good. No discomfort when palpating your stomach, chest, or your back portion. And then on the lower extremities, skin looked great, didn't see any open lesions at all. And also cap refills on the toe, circulation was good. And on your hands and fingers, cap refill was great. No abnormalities there. Skin turgor was good. So dehydration was up to par, or excuse me, hydration was up to par. And I think we pretty much covered everything today. Eyesight was good. No abnormalities were there. Didn't see anything moving back, forward. Anything open in the mouth. Teeth look great. Tonsils look great. One thing I do want to check, I think that we may have overlooked, was just me feeling your trachea. So I'm going to go ahead. Okay, trachea is midline, good. And then let me check those lymph nodes once again. Okay, good. I think this concludes our physical assessment for today. Thank you for being so great.
Thank you.
You have any questions for me at all?